Recording. Perfect. Hello, everyone. This is Evgenia, and today we continue our conversation about brain health, about all issues, diseases related to the subject matter. And today we have Dr. Professor from John Hopkins. His specialization is in neuropsychiatry. Dr. Adam Kaplin, thank you so much for being with us today.
Thank you so much for asking me. I'm privileged to be here.
I know that you're founder of several companies. I know that your most recent adventure is Minerve Pharmaceuticals, right?
Yes. So it's funny you pronounce it. The French pronunciation is, I think, how you've done it, but it's Minerve is the way we pronounce it because Minerva was already taken, and but the French spelling of it, Minerve, is Minerve. But yes, that's what we're doing. We're trying to combat Alzheimer's.
Yes, extremely fascinating. So anyhow, when I was trying to when I got in touch with you and I looked at your profile, it was mind-blowing. I've discovered so many things. That's like, seriously, it's mind-blowing things. And I really would like to discuss a lot, like at least some of them, because we don't have that much time. Anyhow, the things you do, extremely outstanding. And let's talk the entire idea of the connection between immune system and psychiatric disorders, neurological disorders, pain. It's that's so interesting. There are so many perspectives in terms of like treatment, in terms of like understanding the causes, etc., etc. And let's talk first of all about causes. Because a lot of us think that the major role in the most neurological psychiatric disorders actually genetics that comes from families. A lot of things like addictions. A lot of people, they still believe that it's actually more genetic than anything else. Yes. So what is the most impactful cause of a disease?
So when you say of a disease, are we talking about
depression? I know that let's talk about depression.
Okay, great. So essentially, when I graduated from my training, my MD Ph.D. degree, and then did my training in psychiatry, specialization in neuropsychiatry, sort of the interface between the biological basis of these mental illnesses and the like. I hated depression. I hated what it does to individuals. I hate what it does to families and as it involves. And of course, suicide is now the second leading cause of death for our children 10 to 34 years of age. It is, the rates have gone up 30 to 40% over the past couple decades. So we're losing the battle here. And so I wanted to make inroads. The problem is that the diagnostic criteria we have for depression are, having trouble with sleep, interest, guilt, energy, mood, concentration, appetite, psychomotor retardation, and suicidal ideation. There's 227 different combinations of those taken.
So let's pause here. Because that's important. That's very important. So basically, we see a lot of people associate depression with something like sadness, bad mood, but that's not. There are so many symptoms behind of it. That can be sleep apnea, right? It can be. It can be so many. It can be like issues with attention, right?
Yep. So concentration is one of the cardinal symptoms, and what people, as you're sort of getting at, people don't realize that this is not just a weakness, not just a downturn in someone's mood temporarily. When people say, "Oh, I went to see a movie last night and it was really depressing," they don't mean they had to go home and take Prozac. They mean that their mood went down. So understanding that this is a disease that is in a number of different contexts, the final common pathway of injury to the brain results in this. But so I hated it, and I wanted to understand it better. There's such a problem of heterogeneity in depression, which is, it's kind of like me saying I want to make inroads into depression. So I'm going to go give this, like I want to make inroads into treating pneumonia. So just by comparison, so I'm going to go treat everybody who coughs. But the problem is people cough for so many reasons that I'm not going to have success. So I wanted to go to where we can get rid of this heterogeneity problem and have everybody have a likelihood of having depression for the same reason. So why did Willie Sutton rob banks? That's where the money is. I went to study depression where had the highest rate of clinical depression of any medical, neurological, or surgical disease, and that is multiple sclerosis, where there's inflammation going on in the brain. And I went just because of its being the record holder, the Michael Phelps, the gold medal winner here of the competition.
I love swimming. You know how I love swimming. I love every single day. And I remember when I remember him. I remember this when he won his first gold medal. I was watching.
Yes. And he has been actually quite good about talking about mental health and, sometimes the positive sides. His ADHD allowed him to do what he needed to do, which is stay active at some points and then just be, just downtime when he just recharges engines. But in any case, so I went to study that. I will tell you, just to cut to the chase, my colleague said, well, maybe you'll understand something about depression in MS. But when it's all said and done, what will you do about idiopathic depression, just the depression everybody suffers from who doesn't have an autoimmune disease? And the one thing I will tell you, Evgenia, is it Evgenia or Evgenia?
Yes, that's right. Evgenia.
Okay, Evgenia. So the one thing that I will tell you is that now, during the time that I've been doing this, we now understand that every single treatment we have for depression, be it SSRIs, SNRIs, ketamine, psilocybin, ECT, they all have potent anti-inflammatory effects, which means that my colleagues have been treating the inflammatory basis of depression without knowing it for the past, 70 years since we've invented some of these things. And we now know that somewhere between 30 and 60% of people who have depression have it being driven significantly from inflammation going on from various causes. So that's the sort of take-home message. The reason why there's a big gap there is that since all of the antidepressants have anti-inflammatory effects, if you study people who are depressed but on antidepressants, you're already bringing down the inflammation. So that's why it's hard to know the exact amount.
Yes. So let's talk a little bit about a very important thing, inflammation. So one of the reasons of development of any psychiatric disorder can be simply in inflammation. So the thing is, how do early life infections, any challenges related to the immune system can influence neurodevelopment and the future risk of any psychiatric disorder? So for example, if kid in early life experiencing, there is a high chance for this person develop serious disease, right?
Yeah, so and this is where we have most information about this, is actually outside of my area of specialization, which is schizophrenia, because we know that being born during certain times of the year, particularly in the sort of winter months when the rates of infections are higher, having an infection increases the risk of this. And so it is something that we know that early times has impacts on people. But what I will tell you, just to dispel some of this, is, and what you're getting at is that the risk of depression, for instance, with MS, is not higher if you have family history of it, because the inflammation that comes from the MS is so enormous that I wanted to say it trumps, but it clouds or overshadows, outguns the risk of the genetic contribution. So as you say, infections are a cause of ongoing inflammation, as is other things like autoimmune diseases. So you were going to jump in, please.
So we got this moment. So basically, if a person has any chronic condition,
Yeah.
There's a high chance to develop any psychiatric disorder, right? Including any neurological, right, condition.
Yeah, so I mean, it's hard to say any, but no question that any condition that involves inflammation, diabetes, arthritis, MS, lupus, any of these conditions have associated with them an immune component. And as you suggested earlier, it is also true that pain, for reasons that we don't fully understand, is also chronic pain is associated with inflammation in the nervous system.
That's a very important subject matter. Are you getting, because I saw the experiments you showed on some of your videos regarding that. Like literally, if we simply change temperature in the brain, you will see like tremendous change in the mood. And we have different type of pain. There are so many of us, like very different on the nerve. We know that there are different things related to that. The thing is, I know that usually inflammation goes, especially if we are talking about muscle skeleton, when like people got hurt in terms of like bones, in terms of like back. Usually, inflammation highly associated with the pain.
Yep.
When we're talking about brain, where is the line? Usually, if there is inflammation, there is always pain. Like we know that the people can experience psychiatric disorders, mood change, etc. In terms of pain, what kind of pain usually people like? If we're talking about like pain wise.
Yeah, so it's chronic pain. So it's the chronicity of the pain that is associated with the depression. So people can have acute pain, and and the interface for this, where these things come together, is at the point of the HPA axis, the hypothalamic pituitary adrenal axis. And the reason why that is, you know, people talk about steroids, prednisone, all of these things. These are things that are used, and people say, oh, cortisol, it's the stress hormone. But no one goes to the pharmacy to get prednisone because they're stressed. They go because they have inflammation. So this HPA axis, which releases cortisol, and it is the brake of the immune system, is what is regulating our ability to respond to inflammation. And what happens is, and this is sort of the cutting to the chase here, is that if you have any chronic condition such as depression or chronic pain, what happens is you have elevated cortisol levels. And when the body responds to having high levels of any substance that has receptors associated with it, it downregulates the receptors. It says, oh, wait a minute, cortisol is going to be up all the time. We're going to stop responding to it as though we have to stop the immune system. And you become what's called cortisol resistant, which is the body stops listening. It's like you've been riding your emergency brake all the time. And now if you need to go pull it, it won't respond anymore. That's the effect of chronic pain and chronic anxiety and chronic depression, which is it actually prevents you from being able to then calm the immune system down. Your emergency brake has been worn out. And now if you have an infection or pain or something like that, you can no longer quiet the immune system down. And as a result, you have increased inflammation. This is also important, by the way. One thing just worth mentioning is that I also have spent some time on, is it turns out having the belief your life has a purpose is what Viktor Frankl's work was done on, man's search for meaning in life. But it turns out having the belief that your life has a purpose is associated with a 60% reduction in progressing to Alzheimer's, roughly the same amount reduction in heart attacks, in strokes, and for people over the age of 50, like myself, the all-cause mortality from having a high purpose in life versus a low purpose in life. Having a low purpose in life is associated with having a 30% increase in all-cause mortality. And why is that? Because having a purpose in life, believing your life has purpose, as yours does with this what you're doing here, spreading the word and the like, is
Yeah, it
associated.
was a huge role with motivation. Question about
Yep.
you mentioned chronic conditions, steroids, etc. So I would like to really mention it, like articulate it, because for some people it could be like really hard to understand right away. So
Yep.
if we're talking about like the causes of depression can be so varied, including, for example, if we're talking about allergy, nowadays almost every single person has allergy.
Yes.
As I understood, allergy can be a cause of a significant. It's basically it put you in a significant risk for development of certain diseases, including depression, right?
Yeah.
It's saying basically also some medication can have a side effect, right?
Yep.
I think it's very important to articulate and make a stop about
Yeah.
say that. Also, there is a huge difference between women and men. And I understood women, just by mother nature, have higher risk of developing depression.
Yes.
Depression in particular. Mm-hmm.
Yeah. So you touch on so many different topics, and I understand why you were interested.
I think they're mind blowing, and I
Yes,
think
yes, yes. No, I totally get it. But since we are in April, it's worth mentioning that many people think, oh my God, the time for depression and suicide, it's over the holidays, and that is absolutely wrong. During Christmas time and the winter holidays, the risk of going to the emergency room, killing yourself, starting a new psychiatric appointment is the lowest of the entire year. The increased risk is April, the month we are in. And the reason why I bring that up in the context of what you're talking about is many people believe that this is the time of all of the pollen and the sort of allergies that get going, and they stimulate inflammation, and many people think it's that inflammation that is the reason. T.S. Eliot said April's the cruelest month. That's when the suicide rates are the highest, not over the winter holidays. They're lowest then. And probably you're right that allergies are playing a role in inflammation and causing this to occur during this time of the year. But this is when people should be particularly mindful of people who have depression and keep an eye on them.
So that's good. I mean, that's good to mention. So we basically know that any anti-inflammatory pill can literally help with the psychiatric disorders, right? If there is any inflammation related.
Well, so this is a great question. You're saying any anti-inflammatory? Is that this is what? Yeah. So
I'm literally saying any because I believe it's very because it's there are so many like differences versus there are so many things involved. But as I understood, I read a couple of articles. I watched some videos. There is anti-inflammation, like any anti-inflammatory medication can really help. With the
So you're absolutely right. Now the problem with this set of studies is that, again, it's the heterogeneity. So for instance, one of the landmark studies that was done by Dr. Miller at Emory, where he took patients who were depressed, had severe depression, put them on a TNF alpha inhibitor. TNF alpha is kind of the very first inflammatory response to anything. Any infection, any allergy, this is sort of what happens. And he put people on these TNF alpha inhibitors. And then he looked at the whole data, and the whole data did not show a statistically significant decrease. But when he went back and he looked at only those people who had elevated levels of inflammation as measured by CRP, C-reactive protein, it's a measurement of someone's level of inflammation. Those people absolutely had a profound response to being on the anti-inflammatory. So it's not everybody. It's those people who have elevated levels of inflammation, because you can get depressed just by doing things that cause depression, like cocaine. It turns out marijuana for those people who have particularly bipolar disorder, alcohol. So there are many ways of getting depressed. they're not all going to respond to the anti-inflammatories. Only those people who have elevated inflammation, which I say is going to be between 30 and 60% of depressions, but that means 40 to 70% are not going to be associated. They're going to be caused by something else, the genetics you talked about, or drugs, or some of the other causes.
Next thing, extremely important.
Yeah, please.
So because of the combination of factors, any depression can cause dementia, right? In the future, if it will not get treated.
Yeah. So you bring up a really important thing that people often say, oh, well, because high functioning people can just hunker through and not get their depression treated. And they think, oh, it's no big deal. It is a big deal, because untreated depression has an effect. We know that 10 years out, you have untreated depression causes a 20% shrinkage in the hippocampus, which is the part where memories are formed, which therefore explains why you have an increased risk of dementia. And not only that, the inflammation has other effects, so that not only are you at increased risk of getting that, it turns out you have doubled your risk in untreated depression of getting an autoimmune disease. It is a risk factor for lupus, MS, inflammatory bowel disease. All of these have been shown. You double your risk of getting these diseases if you do not treat. If you treat the depression, your risk comes back down. Why is this the case? And it's what we talked about before. When you have depression, you have elevated cortisol levels. That makes your emergency brake not work. And then if you get infected by a virus that is hiding by looking like some part of the body, and then you go to pull the emergency brake, you can't calm your inflammatory response, and you put yourself at risk of getting an autoimmune disease.
You point out to the very important subject matter in terms of COVID. I know that the role, things that happen to literally to all of us, yeah, during COVID and after, like nothing will change. I know that it's long-term COVID. I know some friends of mine, yeah, have got serious condition related, yeah, to the brain health, like related to other chronic condition. That's a serious concern. So do we have any numbers related to, I know there are like million, we got like plus millions of people, like 50 million, right? Or so, something like, how many people, like, do you have any statistics in mind? Just what the influence of COVID, can we even measure?
Yeah. So the best studies that I know of there's a couple studies, and you're absolutely right, by the way. The reason why I was asked to see patients who were released from the intensive care unit after getting COVID is because you're absolutely right, it was an inflammatory mediated condition. It's not that COVID kills you, it's your immune response to it that kills you. It's your own immune system that melts the lungs and does all of that, because COVID just overactivates things. And that's why I was involved in the care of those patients when they were released. And the best data we have says that 50% of people, if you look 3 months out after a COVID infection, will have a major depressive episode. And before we had Paxlovid, one of the best treatments for COVID was to put people on an antidepressant, in this case fluvoxamine, which decreased people's risk of going into the hospital, because again, it brought down this cortisol levels. It brought down this immune response that happened. And incidentally, it is worth mentioning that people who have MS who are not depressed and get put on Prozac are half as likely to have new lesions based on a randomized controlled study that were done. So it is the anti-inflammatory effects of these drugs that is playing an important role in their therapeutic response.
Very important thing to mention. I looked at the way you were explaining the entire nature in the course, the path depression has in our mind, in our brain.
Mhm.
So did I understand? Did I understand it right? So the thing is, depression. We have sometimes bad moods. We all do have.
Yeah.
But depression, we are talking about like it's a matter of like time frame. And the thing is, there is no depression will put you. The thing is, it's like you have to via medication. You have to like do some treatments. You have because to put yourself in some sort of a remission state. Without it, you have a serious concern related. You can get serious cognitive decline. There are lots of risks associated with it. So depression has to be treated. And depression, it's a matter of like it's a consistent something like consistent symptoms that goes for a while, right?
Yeah.
It's more than 6 months. And the thing is, our brain works in a way that it will always put you there, right? So the thing is, I believe you have better perspective on those things. So the thing is, if a person has a depression for long term, right? For the long term, we see the symptoms for a long term. We know that there is a certain issue. So meaning that it's in the brain. It's some sort of reaction. It's the way how brain cope with a certain situation. Is there any way to get out of this vicious cycle without medication? And it's wired completely. It's there in the brain, whatever it could happen. It could be like some dramatic situation. It could be whatever. It could be just some coping mechanism to certain condition. So is there any way to get out, or it's up there? Doesn't matter what, something can trigger you and you will get back. Is there any way to like completely raise it up from the brain?
Sure. So let me first deal with the chronicity issue and then deal with the treatment issues. Two very important things. So the chronicity, we tell our residents and medical students that one of the big differences, differential diagnosis between depression, is it just sadness or is it a clinical depression? This is the big difference. And we talk about how sadness is just one of the 9 cardinal symptoms of depression. And so we say cough is to pneumonia what sadness is to depression. Lots of people will cough and not have pneumonia. Sometimes you get pneumonia without a cough, particularly in the young and the very old. And so what you have to consider for pneumonia is the company that the cough keeps. If it's a cough with increased respiration and a sort of an area on an X-ray that shows infiltration in the lungs, we call that pneumonia. What we call depression, clinical depression, is having 5 of these 9 symptoms that affect people's what we call neurovegetative symptoms. It affects your sleep. You can actually measure differences in someone's sleep cycle. It affects the way food tastes. It affects your ability to mount a response, to be excited about something and the like. And one of the cardinal things that isn't one of the diagnoses, but that is very important, is the mental flexibility, the ability to see that there are many options, many opportunities, that it doesn't have to be all bleak, that it might get better one day. This hopelessness that comes with depression is what increases the risk for suicide. Okay, so it is this chronicity that the company that it keeps, you have to have 5 of those 9 symptoms. And in terms of treatment, if it is mild to moderate even depression, then yes, there are things you can do. Exercise turns out to increase the number of growth hormones for the brain, brain-derived growth hormones and the like. These things are really good for the brain. They help combat the negative impact of depression on the brain and prevent that shrinkage of the hippocampus, etc. So exercise is a great way to do it. The problem is that in the studies that showed exercise for mild to moderate depression was as good as Zoloft when people did it, was you had to screen 10 patients who had depression to find one that was able to exercise to the extent that they needed to do to have the anti-inflammatory effects. So the problem is exercise is a great antidepressant. The other great antidepressant is cognitive behavioral therapy, learning to not let things spiral and get worse and worse in your mind, and the like, and to basically build mental flexibility into the situation, is great. We know that talk therapy works slower, but has a long-term benefit that you don't get from antidepressants. Antidepressants by themselves work faster and protect the brain, but they don't have the ability to prevent a new episode as much as cognitive behavioral therapy. So the two together are better than either one alone. That's sort of a take-home message.
Very important subject matter you mentioned in terms of exercise. We know well. You can do all possible things. There are so many. We have a lot of options available. But the thing is, what I realized, like it's my personal background and personal experience, and I already know. I was speaking with multiple doctors again. We don't. We for the most part we can hear our body, and we don't know exactly. So the thing is, there is a very thin line between the positive outcomes of exercise. Because unfortunately, most of us, we have no idea what our body needs. And moreover, most of us cannot simply even hear our own body. And the thing is, we don't, and for our body is extremely important to this cycle. We need always, body needs time to recover. And all the time people they don't know in which stage, like they did like, for example, very intensive training, and they don't know in which stage their muscles, their body are. And and the thing is, all those exercises, it's actually, I know that all people, they try to exercise like super hard because, we know exercise helps, we will lose weight, we will do, strong.
Well, I've been there. I've done that. Yes.
They do it so hard, and the thing is, they hurt themselves even more. They getting even more dizzy. So be careful with exercise. Like, very good, but unfortunately, when people out on the stage, they can hear, understand what they actually do, how it impacts their body. We're actually working on one product. It's called Superhuman Health, and part of it is actually help. We use like heart rate variability and other metrics to basically understand like saturation, the oxygen saturation, other things that basically help to understand in which stage what body need. Like simply hear and respond, like know what you're doing. It's because that's simple. That's a super simple thing, but extremely important.
Yeah.
And another very important aspect, because I have several very enthusiastic friends of mine, because they're so into it. I'm like, every single day I'm waking up, I see like 10 posts from them related to this. They're from, they're from Europe, from United States.
Yeah.
Gut, brain axis, and immune.
Gut, brain, what? I'm sorry.
Gut, brain axis. Basically, we know that microbiome in our gut, it has significant influence on our immune system, on the way our brain works. We know about it.
Yeah.
Do we know, like, because we know have a lot of like recommendations that if you have like any psychiatric disorder, neurological blah disorder, you're supposed to take care of your gut. You're supposed to keep your microbiome, your biome in check. You have to like to eat specific food, whatever, more kimchi, kombucha, blah blah blah. We all know about it.
And you're in the Bay Area, aren't you? That must be everybody is talking about the impact of all of those things on people's moods and
well
health.
when you go to the Sprouts or any store, it's like literally like shelves.
Yeah, absolutely.
And the thing is, I think it's only part of the problem. Okay, you got okay. We see there is a bacteria. That's perfect. But you have to put some attention, like how this bacteria is going to survive.
Yes. No, we're at the very beginning of understanding the microbiome and how to change it. But you do have to remember that anything you eat, from your mouth to where you get rid of food, it's all really outside of the body. But it is, all your gut is lined with immune cells ready to respond to these things that get in, go through your body that are bacteria and viruses. And so your immune response starts, you don't normally cut yourself daily, but you eat daily, and that means you introduce right into parts of your body things that can cause inflammation and infection. But you're right that we don't yet know what the good bacteria are, what the bad bacteria are, exactly how to balance it. But I would say that, and my significant other would kill me if I didn't at least acknowledge that, particularly for people who have autoimmune diseases, we know that inflammation is absolutely set off by certain things that we eat, and trying to get back to some of the basics and not all this processed food that are, about which we know very little, but we know cause inflammation, are things that people should be aware of. So,
yeah, yes, I think it's very important to mention.
yeah.
Next few several questions I have, they're more scientific. Let's a little bit cover this up, maybe because they are like more related to the more modern vision of the science. Basically,
Sure.
let's discuss. Let's basically touch them a little bit. Do we know currently which immune cells are most influential in modulating brain function and behavior?
Yeah. So, I mean, what is remarkable about the immune system is that any piece of it that you grab onto is connected to everything else. So, just as an example of how confusing this can be, no question that all of our data said it was T cells that mediate the main inflammatory components of multiple sclerosis. The T cells are what are taken out with HIV. They're the generals of the immune system. And I could give you lots of examples of where we knew that T cells are playing a very important role. But now the number one treatment that people are being put on are anti-B cell treatments. And there's a couple of reasons for that. One is that B cells are what present antigens, are what get the T cells going. But no one anticipated how powerful these anti-B cells were. The other thing is you can take out B cells. If you take out T cells, you get HIV, the whole system collapses, and you can intervene on B cells and still leave the rest of the immune system intact. So I'm only bringing this up to say everybody would have told you 20 years ago it's all T cells for for multiple sclerosis, but the treatments we're now using are B cell treatments. So to say that there's just one thing is impossible because they are all working together. And any one piece of it is tied to every other piece. So does that, I'm not trying to, side step the question, but it is impossible to say that there's just one thing. And the other thing that's worth mentioning, which is sort of part of your question, is we still don't know how it is that inflammation in the body is transmitted to the brain. We know it is, but we don't know exactly how that signal outside is transmitted to the brain. We do know the brain translates the signal to quiet the immune system down through the vagus nerve, because we know the vagus nerve releases acetylcholine in the body. That acetylcholine binds to white blood cells and gets them to decrease their TNF alpha production. A lot of very good work done in that area. So we know the brain controls the immune system, but we don't, and we know inflammation in the body has effects on the brain, but we don't know exactly how those signals are communicated.
The question about blood-brain barrier is there.
Yeah.
So can peripheral immune activation cross the blood-brain barrier, and under what condition does this occur? It's interesting, just a question, because you mentioned like we don't know the mechanism. It's interesting because I know when I was like, because I have a tradition. When I started to work on my human brain expert in the 3H brain, I started to like at least once a week I go to global pattern applications database, and I'm looking through like globally what's new, because it's much easier to look at the pattern applications, because articles, there are millions of them. People post articles up there without there are very to post article, you don't have to have like, there is no significant process, process to be published. When you look at the patent application, there is a lot of like the approach, whatever treatment, whatever, it has really be innovative. It has been like new. It has significant differentiation what had been done before. So for me, it's a tradition. I'm doing it every single week. So every time I'm looking at it, and there are so many things currently, like already, like people have from all around the globe, they work on like in a different direction. There are so many like interpretation, the visions, the passages of blood-brain barrier. It's been already for for centuries, for years, because this blood-brain barrier is very significant. It's a very important subject because basically it's what connects body.
Yes, yeah, absolutely.
Gatekeeper.
Yeah, no question. It's really critical. It's interesting because what hearing you talk reminds me of why I 4 years ago transitioned from working on scientific approach in academia to industry, because the really good ideas, the new ideas, usually come from academia, but industry are the people who can convert those ideas into drugs. Because you're right, what scientists want to do is it's publish or perish. We just have to get our grants and we have to get our ideas into publication. However, that works. It's just important to get it there. It's not important to us to then put it into the literature in a way that could lead to new treatments, because that's not our strength. So what I've been trying to do is bridge that gap between being a scientist working in industry to try to help sort of get the benefits of academia with these ideas and industry with the ability to convert them into things. One other thing that also I just wanted to bring up, which has been part of what you've been talking about the whole time, is that when we talk about depression and its role in inflammation and how chronic stress and chronic pain play a role in all of this, you brought up COVID. It's also worth mentioning, without getting political, that this is a time of great stress for many people because changes are taking place. And I'm not trying to get political here, but change is stressful and people are experiencing the stress. So we went from COVID, which has a tremendous long-term impact on people's stress, to now all of the changes this country is going through. And this is a time where people really do need to be watching you and watching this show and understanding these things, because this is the setup for a significant rise in depression, because of everything that's been going on with both the biological stressor and the environmental stressor of change. So,
oh my God, yes. Well, we literally, because I'm trying to gather people. We have soon a symposium coming related to psycholinguistics, etc. Politics, it's only part of it. And I believe that the situation we're in, we crafted it. Like we people, we crafted the situation we have now. And I believe there are multiple components involved. The way we, because our lifestyles changed a lot. Like we have so many, in terms of digital, we communicate a lot with the digital media. The way how we communicate with it, it's impact us. It brings like new issues. And I believe new solutions too. It's the way how you manage things. But anyway, even the way how we approaching, dealing, solving, all sorts of AI is available now. It puts so much people in the stress because some people losing jobs, some people have no idea what's going on. Some people especially the older one who's a little bit slower, then they feel like, because where older people, for them it's extremely important, to avoid dementia, all this, they have to be connected to the world, keep being active. And the thing is, the new stuff, because they make so many changes, and they literally they scared of them because they don't know, because they get confused. They're
Yeah.
simple, you know. They work very simple, but it's simple for someone who been grown up and raised already with the electronic devices. We know that AI is just simple thing, and it's just simplifies us. But for some older generation, it's really like put them in a depression, but simply because they don't know what to do. Like they really think that, oh my God, that things more better than me. I just better go. I will just let kids run it. I don't want to like even, and that's I think that's certain threat for the human cognition also. You know,
Yeah. You bring up.
I never will substitute brain, because our brain has so many things, so many biologically made, like we have so many mechanisms. We don't even know all of them. Like we're still in the process of discovery. Human brain is such a fascinating subject matter, and unfortunately, not that many people like really want to embrace at least part of it. And
Oh
look at
yeah,
it
it's
more
the
critically.
last frontier. We don't know. We know more about what's farther out in space or at the bottoms of our oceans, or what happened in the first few milliseconds after the Big Bang, than we know about what a thought is. I mean, this is our last frontier. But you bring up a very good question, a very good point, which is that I could show you data which is absolutely, you can't argue with it, that the rise in suicide among our young people correlates perfectly with the introduction of social media. There's no question about it. And that you're right, that what's going on now globally is not based on any one thing. Globally, there's more of this extremism. People are not able to talk to one another across lines and the like. And this change has to be happening from something. And I do think it's the way information is now coming to us fast and furious, without any objective sort of source of anchoring us, that people are unable to cross divides, whether it's political or racial or sexual or these kinds of things. These extreme views are now becoming part and parcel of our human experience. And I think it is the technology that's having a role here.
You know what? I believe that without like before people were more social, like because they have to be adopted in the human society. They have to speak
That's a very good point.
with
That's
with the
a
people.
very
And
good.
moreover, when I've heard one person talking about like his childhood experience, because
Yeah.
the kids were playing mostly outside, and they had a lot more physical activities. We know that like, the brains of kids born like later in earlier the changes, like kids now
Yeah.
they have the visual
I
cortex.
think that's a brilliant point. It's not just the information coming across, it's the secondary effects of spending all our time associated with these devices and not bringing us together and having the exchange from being
Device,
physically
yes,
with people.
the device brings you a barrier. You can be more harsh. You can be more. You don't have to put any effort to like think.
I think that's really a really brilliant point that you're bringing
Because
up.
when you're around people and you're talking directly to a person, it's a different thing,
Yeah.
Now,
The problem is that, the people who do a lot of research on this kind of stuff aren't necessarily the people who are at the cutting edge of research. So, sorry, of technology. So as a result, we are so slow at studying the impact of the technology that's changing our entire world, because the old wise, professors, they don't know what's on the cutting edge, and things change so fast. When you
uh,
think, yeah,
that's
go ahead.
interesting. That's interesting because I literally was like a couple of days. I mean, for the last couple of days, I was looking for different like people. Like, I really want to bring some like interesting personalities, like about in this, to talk about the subject matter related to like computer psychology. And the thing is, every time I look for like the top companies, Apple, Google, the people who actually currently work for Google, like for the top, the kiddos, the kids who
Right.
And the thing is, they consider, like, Google hires them because, they easy to manipulate, and they consider them those guys on the cutting edge. I think that's so wrong, because I looked at them. I looked at multiple profiles, and they work at the top labs at Stanford, Harvard, and I was like, wait a moment.
Yeah. And I mean, to give you an
trust them, like, I have to, like, really put effort to bring, like, combination of, like, knowledge, like real wisdom, real understanding, and, like, really play around. I know that idea of, like, playing with the things, with, like, really opens up your imagination. You can create new things. That's amazing. I think it's a good thing it's always good to have. But the person who really has experience, who's been in the space in the area for a while and has different perspectives, that's more important. That's more important than just.
It's important that there be a crosstalk and information that goes back and forth. And it doesn't go back and forth. And just as one example of the absurdity of this, of just how crazy it is, there are so many people in education who are saying, oh my God, ChatGPT and these large language models and the like are all evil because it's going to prevent our kids from being able to think independently. So they are trying to stamp out kids' use of these things during their education. And yet, if they think about it for half a second, they're also aware that jobs are going to be lost to those people who don't know artificial intelligence and don't know how to use this tool. So on the one hand, they're saying, no, stay away, it's evil. And on the other hand, it's exactly what kids need to know about in order to survive in the world. And that's because it's a generational gap. And the absurdity of saying, it's like saying, don't use Google searches, don't use the internet, because it's going to prevent you from being able to go to the library and look up things like we used to have to do. It's absurd, this generational gap about
yes, that's absurd. Yes, and I believe it's extremely important to, like, really make people connected, really find some compromise, really like understand that both perspectives is, like, have chance for survival. But it's very important to have a good you can't go to the extremes, and you have to be very conscious. And I believe the wisdom, the experience, like, the more maybe with age, maybe the older I get, the more, when I was in my when I was doing my PhD, I had so much energy. I was, like, doing so many things. Sure. And I remember my our group leaders, she always were talking to me, you lead every single day like you lost. You have to be more conscious about other things. And she was so smart and so right. The older I get, the more I understand that sometimes more thing, like the activity, all this energy that implies to younger generation, that, like, it's sometimes it works against you. And it's very important to have to give someone who older with better, with more life experience, because there is a study being done. It was just basically lab experiment between, can a robot teach? Like, so they took a person, okay, and tried to make this person learn a specific skill, okay. And the person tried to learn from the robot, and it didn't work. It didn't work. And the thing is, when they even put this person with the experienced one, with the real person who has experience and knowledge, it took very short period of time for a person to learn things. So a lot of things we learn unconscious.
Yeah, I mean, it just, if there is one take-home message from our conversation, I think it's this. I think the
so we're done tomorrow.
Well, we have 2 minutes, but I will tell you, the take-home message from our conversation is that what is so crucial nowadays because of the complexity of things is to have people go across the normal divides. So to have a psychiatrist who can work with neurologists, to have people who can have your background in science and chemistry and can also be educators. It is Republicans and Democrats. It's people from different countries. It is the ability that all of us together are smarter than any one of us alone. And it's the collaboration that is going to save us, or if we don't do it, cause the endless problems that we have is from not communicating, not collaborating. That would be the take-home message.
Yeah, 100%. I believe humanity is always wins. I believe humanity is very, I mean, it's very core of everything. Anyhow, last question about, because that's, I think it's very popular in the last years. Let's talk a little bit about biomarkers.
Yes.
Can immune-based biomarkers be used to subtype patients for more personalized psychiatric treatments? So basically, we're talking about immune-based biomarkers.
Yeah. And yes, we need them. So one of the things that's a good example here is that what's revolutionized our ability to treat diabetes is to have a biomarker called hemoglobin A1C. It's that your glucose can go up and down and up and down. That's not helpful to your doctor. What the doctor wants to know is chronically for the past month or few months, what has the average level been? And if it's been up for a long time, that sugar adds itself to proteins, hemoglobin being one of them. You can measure that addition. The reason why that's important is that gives you a general idea of the entire system over time. We need a hemoglobin A1C for cortisol, for stress, and the effects of inflammation. And we don't have that. And the problem with not having that is your cortisol level can go up acutely because you got into a car accident, thank God you survived, but your stress went way up. That acute rise in stress is actually good for quieting the immune system down, because that acute response is like pulling the emergency brake acutely after you want to avoid getting into a collision. Great. It's when it's up chronically that the body stops listening to it. That's the problem. So yes, biomarkers are important, but we don't yet have the ability to measure our hemoglobin A1C of stress and the HPA axis. So the problem is that acutely some people's stress markers can go up, and that's actually not necessarily a bad thing. It's when they're up chronically that's the problem. So we need to get there. We need to get our hemoglobin A1C for the HPA axis for our stress levels chronically. We don't yet have it. But as a general marker, we can measure stress levels, C-reactive protein, erythrocyte sedimentation reactions, IL-6 levels. We can measure these things acutely that are a cross-section in time, what someone's level of inflammation, but we really need to have the ability to do it chronically. So it's coming, we're just not there yet.
But future is exciting. Thank you so much for your time. It was extremely fascinating. Thank you.
It was great to talk to you. Thanks for the time. I appreciate it.